Hi. After meeting with your son Jackson, I believe that he has a severe phonological disorder. This means that Jackson is using phonological processes that is not typical for his age. A phonological process is something that is used by young children who are developing and learning how to talk. They use it to try to make words easier for them to say, and the phonological processes are usually eliminated by a certain age, but that has not happened for Jackson, so he is continuing to use these phonological processes. Children with phonological processes have difficulty learning the phonological system of their language, and this results in them having a difficult time accurately producing several sounds of speech. The phonological system of a language is what governs what speech sounds can go together. Next, I would like to talk about the different components of Jackson's assessment. So, for the case history, you shared with me that Jackson is currently living at home with you and your husband, and he is not receiving any services at school. As for the communication and medical history, you shared with me that Jackson started babbling and talking at an appropriate age, and you had a normal pregnancy and birth, and he does not currently have any medical conditions, but as a baby he did have reoccurring ear infections. And you also shared that many people inside and outside the family or the house have a difficult time understanding Jackson. I performed an oral mechanism exam on Jackson, and I didn't see any weakness or paralysis in the muscles needed for speech, and he didn't have any problems with chewing or swallowing, so his range of motion seemed completely normal. I also performed a hearing screening, and I looked at his tympanogram. So Jackson did fail his hearing screening at 4,000 hertz, and he had a type B tympanogram, and this means that Jackson has fluid in his middle ear. So, next I gave Jackson a speech sound assessment known as the Goldman, and he received a standard score of 40, so this puts him at the severe range for phonological disorder. On the stimmability portion of the assessment, Jackson incorrectly imitated several sounds in the initial, medial, and final parts of different words, and I believe that speech therapy is needed to correct this. For the intelligibility rating, which has nothing to do with intelligence, intelligibility just refers to how well you can understand someone's speech. Jackson's connected speech was rated as good in 0% of his productions. So, on his assessment of speech perception, Jackson scored low on the auditory discrimination task and his auditory lexical discrimination task. So this tells me that Jackson struggles with telling the difference between speech sounds and the order, and he also doesn't understand that if you change a sound in a word, that changes the meaning of the word. Next, I would like to talk about some of the characteristics of Jackson's speech that I noticed during the assessment. So, due to phonological impairment, Jackson makes consistent and predictable speech errors that affect more than just one sound. The phonological processes that Jackson is currently using includes gliding of liquids, stopping of fricatives and affricates, fronting, and final consonant deletion. The number of errors Jackson makes in his speech is consistent with the length of his utterances, and the situation he's in does not seem to have an effect on how many errors he makes in his speech. Along with this, Jackson is not demonstrating any disruption in his prosody, and he has good control of his pitch and loudness. As for treatment options, I recommend that I start seeing Jackson for speech therapy 3 times a week until the end of the school year, and then he'll need to be reevaluated. I also recommend that Jackson goes to see a audiologist or an ENT so that he can get his ears checked out and try to get the fluid taken care of. In speech therapy, I would like to target increasing Jackson's intelligibility and speech perception, as well as eliminating Jackson's use of gliding liquids, stopping of fricatives and affricates, fronting, and final consonant deletion. The approach I would like to use with Jackson is the cycles approach. So the cycles approach is used for children who have severe to profound phonological disorders. This approach will allow me to work with Jackson on a phonological disorder for a certain amount of time, and then we will move on to the next one. As for interventions, I would like to use multiple oppositions, which will help make Jackson more familiar with different sounds, minimal pairs, which will expose Jackson to words that differ by one sound and help make him more aware of that, and maximal oppositions, which will target sounds that differ in several different ways. If you would like to do your own research and find additional information about this, I recommend checking out the American Speech and Hearing Association, also known as ASHA's website. You can find a lot of information there. So, do you have any questions for me? So, what causes phonological disorders? There is no known cause, but there are several risk factors. One is gender. It seems that boys are more likely to have a phonological disorder than girls. Family history, pre and perinatal problems, and also persistent otitis media and effusion, which means fluid in the middle ear, which, as we know, Jackson has due to his tympanogram being type B.